Wrapping up our period problems series talking about heavy periods. What I mean by that is if you're saturating a regular pad or tampon more than every 3 to 4 hours, I would consider you probably in the heavier period category and probably would suggest investigating it a little bit. So some of the most common reasons, unopposed estrogen or estrogen dominance, where your estrogen levels relative to progesterone are out of balance. Either you have normal estrogen, low progesterone, or high estrogen, normal progesterone. There are many different ways in which this could manifest, but if your estrogen levels are too high or your progesterone levels are too low, you may experience heavy flow. Inflammation and elevated prostaglandins, related to what we talked about in our last video, can definitely contribute. Hypothyroidism, which we talked about in our first period problems series video, can contribute. What else? Uterine fibroids, uterine polyps are pretty infamous actually for causing heavy bleeding, so an ultrasound to rule that out, or looking inside the uterus with a scope can be helpful. Adenomyosis, the ugly stepchild to endometriosis, where the endometrial tissue goes inside the lining of the uterus, also notorious for causing almost hemorrhagic bleeding in some people. And anemia. So we think of anemia as contributing or being caused by heavy flow, but it can also contribute to heavy flow and create kind of a vicious cycle for some folks.